What is malaria? Malaria is a serious tropical disease spread by mosquitoes. If it isn't diagnosed and treated quickly, it can be fatal. A single mosquito bite is all it takes for someone to become infected. The mosquito transfers parasites into that person's bloodstream. Malaria is rare in the United States and common in tropical countries such as Africa and Asia. Malaria is treatable if it's caught early. Malaria is a serious disease that spreads when an infected mosquito bites a human. Tiny parasites can infect mosquitoes. When it bites, the mosquito injects malaria parasites into the person's bloodstream. If it isn't treated, malaria can cause severe health problems such as seizures, brain damage, trouble breathing, organ failure and death. People who get malaria are typically very sick with high fevers, shaking chills, and flu-like illness. 4 kinds of malaria parasites infect humans: Plasmodium falciparum, P. vivax, P. avali, and P. malariae. In addition, P. knowlesi, a type of malaria that naturally infects macaques in Southeast Asia, also infects humans. It causes malaria that is transmitted from animal to human, zoonotic malaria. P. falciparum is the type of malaria that is most likely to result in severe infections and, if not promptly treated, may lead to death. If you're traveling to an area where malaria is common, talk to your doctor about malaria prevention. Worldwide, more than 220 million people get malaria annually. The majority of these cases occur in Africa and South Asia. Around 450,000 people die from the disease every year. It's common in developing countries and areas with warm temperatures and high humidity, including Africa, Central, and South America, Dominican Republic, Haiti and other areas in the Caribbean, Eastern Europe, South Asia, islands in the Central and South Pacific Ocean, Oceania. More than 90% of malaria deaths occur in Africa, and nearly all of the people who die are young children. Anyone can get malaria, but people who live in Africa have a higher risk of infection than others. Young children, older people and pregnant women have an increased risk of dying from malaria. People who live in poverty and don't have access to health care are more likely to have complications from the disease. Types of malaria. There are 5 species of Plasmodium parasites that affect humans. 2 of them are considered the most dangerous. P. falciparum. This is the most common malaria parasite in Africa, and it causes the most malaria-related deaths in the world. P. falciparum multiplies very quickly, causing serious blood loss and clogged blood vessels. P. vivax. This is the malaria parasite most commonly found outside of sub-Saharan Africa, especially in Asia and Latin America. This species can lie dormant, then rise up to infect your blood months or years after the mosquito bite. Symptoms of malaria. It's important to be aware of the symptoms of malaria if you're traveling to areas where there's a high risk of the disease. This means that you can get medical attention quickly. Symptoms are similar to those of flu and usually appear 6 to 30 days after the mosquito bite, but it can sometimes take up to a year for symptoms to start. The symptoms of malaria typically develop within 10 days to 4 weeks following the infection. In some cases, symptoms may not develop for several months. Some malarial parasites can enter the body but will be dormant for long periods of time. Common symptoms of malaria include shaking chills that can range from moderate to severe, nausea, vomiting, abdominal pain, diarrhea, anemia, convulsions, coma, bloody stools, a high temperature, fever, headache, muscle aches or pains. These symptoms can start mild and may be difficult to identify as malaria. What causes malaria? Malaria can occur if a mosquito infected with the Plasmodium parasite bites you. There are 4 kinds of malaria parasites that can infect humans: Plasmodium vivax, P. avali, P. malariae, and P. falciparum. P. falciparum causes a more severe form of the disease, and those who contract this form of malaria have a higher risk of death. An infected mother can also pass the disease to her baby at birth. This is known as congenital malaria. Malaria is transmitted by blood, so it can also be transmitted through an organ transplant, a transfusion, use of shared needles or syringes, How is malaria transmitted? Usually, people get malaria by being bitten by an infective female Anopheles mosquito. Only Anopheles mosquitoes can transmit malaria, and they must have been infected through a previous blood meal taken from an infected person. When a mosquito bites an infected person, a small amount of blood is taken in which contains microscopic malaria parasites. About 1 week later, when the mosquito takes its next blood meal, these parasites mix with the mosquito's saliva and are injected into the person being bitten. The malaria parasite is found in red blood cells of an infected person. Therefore, malaria can also be transmitted through blood transfusion, organ transplant, or the shared use of needles or syringes contaminated with blood. Malaria may also be transmitted from a mother to her unborn infant before or during delivery, congenital malaria. Is malaria a contagious disease? No. Malaria is not spread from person to person like a cold or the flu, and it cannot be sexually transmitted. You cannot get malaria from casual contact with malaria-infected people, such as sitting next to someone who has malaria. Who is at risk for malaria? Anyone can get malaria. Most cases occur in people who live in countries with malaria transmission. People from countries with no malaria can become infected when they travel to countries with malaria or through a blood transfusion, although this is very rare. Also, an infected mother can transmit malaria to her infant before or during delivery. Who is most at risk of getting very sick and dying from malaria? Plasmodium falciparum is the type of malaria that most often causes severe and life-threatening malaria. This parasite is very common in many countries in Africa south of the Sahara Desert. People who are heavily exposed to the bites of mosquitoes infected with P. falciparum are most at risk of dying from malaria. People who have little or no immunity to malaria, such as young children and pregnant women, or travelers coming from areas with no malaria, are more likely to become very sick and die. Poor people living in rural areas who lack access to healthcare are at greater risk for this disease. As a result of all these factors, an estimated 90% of deaths due to malaria occur in Africa south of the Sahara. Most of these deaths occur in children under 5 years of age. How is malaria diagnosed? Your doctor will be able to diagnose malaria. During your appointment, your doctor will review your health history, including any recent travel to tropical climates. A physical exam will also be performed. Your doctor will be able to determine if you have an enlarged spleen or liver. If you have symptoms of malaria, your doctor may order additional blood tests to confirm your diagnosis. These tests will show whether you have malaria, what type of malaria you have, if your infection is caused by a parasite that's resistant to certain types of drugs, if the disease has caused anemia, if the disease has affected your vital organs. Types of blood tests for malaria include 1. Thick and thin blood smears. These are the most common and accurate malaria tests. A lab technician, doctor, or nurse will take some of your blood and send it to a lab to be stained to make any parasites show clearly. The technician spreads it on a glass slide and looks at it with a microscope. A thin blood smear, also called a blood film, is one drop of blood spread across most of the slide. A thick smear drops the blood on a small area. A normal test does 2 of each. Parasites in your blood. The number of malaria parasites in your blood can change each day. So your test might say you don't have malaria even if you do. For that reason, you may need your blood drawn several times over 2 or 3 days for the best results. 2. Rapid diagnostic test, also called RDT or antigen testing. This is a quick option when blood draws and smears aren't available. Blood taken from a prick on your finger is put on a test strip that changes color to show whether you have malaria or not. This test usually can't tell which of the 4 common species of malaria parasites caused your infection. It also can't tell whether the infection is minor or major. Your doctor should follow up all results with blood smears. 3. Molecular test, also known as polymerase chain reaction test. It can identify the type of parasite, which helps your doctor decide which drugs to prescribe. This test is a good choice if your blood has low number of parasites or if the results of your blood smear are vague. 4. Antibody test. Doctors use this to find out if you've had malaria before. It looks for antibodies that show up in the blood after an infection. 5. Drug resistance test. Some malaria parasites are resistant to drugs, but doctors can test your blood to see if certain drugs will work. 6. Other blood tests. You may also have blood taken for a blood count and chemistry panel. This can tell your doctor how serious your infection is and if it's causing other problems, like anemia or kidney failure. Should infants and children be given anti-malarial drugs? Yes, but not all types of malaria drugs. Children of any age can get malaria. Any child traveling to an area where malaria transmission occurs should use the recommended prevention measures, which often include an anti-malarial drug. However, some anti-malarial drugs are not suitable for children. Doses are based on the child's weight, pregnancy, preconception, and breastfeeding. CDC advises women who are pregnant or likely to become pregnant not to travel to areas where malaria transmission occurs, if possible. Malaria in pregnant women can be more severe than in women who are not pregnant. Malaria can increase the risk for serious pregnancy problems, including prematurity, miscarriage, and stillbirth. If travel to a malarious area cannot be postponed, use of an effective chemoprophylaxis regimen is essential. However, no preventive drugs are completely effective. Please consider these risks, and other health risks as well, and discuss them with your doctor. There is no evidence that chloroquine and mefloquine are associated with congenital defects when used for preventing malaria prophylaxis. CDC does not recommend that women planning pregnancy need to wait a specific period of time after their use before becoming pregnant. However, if women or their doctor wish to decrease the amount of anti-malarial drug in the body before conception, the below table provides information on the half-lives of selected anti-malarial drugs. After 2, 4, and 6 half-lives, approximately 25%, 6%, and 2% of the drug remain in the body. Half-life. Half-lives of selected anti-malarial drugs. Atovaquone 2 to 3 days, chloroquine 6 to 60 days, doxycycline 12 to 24 hours, mefloquine 2 to 3 weeks, primaquine 4 to 7 hours, preguanil 14 to 21 hours, tafenoquine 2 weeks. There are limited data available about the safety of anti-malarial drugs while breastfeeding. However, the amount of anti-malarial drug transferred from the nursing mother to her infant is not thought to be harmful to the infant. Very small amounts of the anti-malarial drugs chloroquine and mefloquine are excreted in the breast milk of women who are breastfeeding. Although there is limited information about the use of doxycycline in breastfeeding women, most experts consider it unlikely to cause any harm. No information is available on the amount of primaquine or tafenoquine that enters human breast milk. The mother and infant should be tested for G6PD deficiency before primaquine is given to a woman who is breastfeeding. Because there is no information on the use of tafenoquine in infants, tafenoquine is not recommended during breastfeeding. It is not known whether atovaquone, which is a component of the anti-malarial drug malarone, is excreted in human milk. Preguanil, the other component of malarone, is excreted in human milk in small quantities. Note: there is little information available on the safety of atovaquone or preguanil to prevent malaria in infants weighing less than 5 kilograms, 11 pounds. CDC does not currently recommend it for the prevention of malaria in women breastfeeding infants weighing less than 5 kilograms. Based on experience with other anti-malarial drugs, the quantity of drug transferred in breast milk is not likely to be enough to provide protection against malaria for the infant. Other preventive measures. You and your family can most effectively prevent malaria by taking all 3 of these important measures. Taking anti-malarial medication to kill the parasites and prevent becoming ill. Keeping mosquitoes from biting you, especially at night. Sleeping under insecticide-treated bed nets, using insect repellent, and wearing long-sleeved clothing if out of doors at night. After returning from an area that has malaria, any traveler who becomes ill with a fever or flu-like illness while traveling, and up to 1 year after returning home, should immediately seek professional medical care. You should tell your healthcare provider that you have been traveling in an area where malaria transmission occurs and ask to be tested for malaria infection. In general, most travelers to an area with malaria are deferred from donating blood for 1 year after their return. People who used to live in countries where malaria transmission occurs cannot donate blood for 3 years. People diagnosed with malaria cannot donate blood for 3 years after treatment, during which time they must have remained free of symptoms of malaria. Blood banks follow strict guidelines for accepting or deferring donors who have been in malaria-endemic areas. They do this to avoid collecting blood for transfusions from an infected donor. When should malaria be treated? The disease should be treated early in its course, before it becomes serious and life-threatening. Several good anti-malarial drugs are available, and should be taken early on. The most important step is to go see a doctor if you are sick and are presently in, or have recently been in, an area with malaria, so that the disease is diagnosed and treated right away. What is the treatment for malaria? Malaria can be cured with prescription drugs. The type of drugs and length of treatment depend on the type of malaria, where the person was infected, their age, whether they are pregnant, and how sick they are at the start of treatment. When is malaria self-treatment recommended? Very rarely. Travelers who are taking effective malaria preventive drugs but who will be traveling for an extended period of time can consult their doctor. Those who will be at higher risk of developing a malaria infection may decide, in consultation with their doctor. As per advice, they can take a long malaria treatment medication, referred to as a reliable supply, in case they develop malaria while traveling. If the traveler develops symptoms of malaria, they should immediately seek medical attention so that they can be examined and diagnosed appropriately. If they are diagnosed with malaria, they will then already have with them a reliable supply of an effective malaria treatment medicine to take. Malaria self-treatment should begin right away if fever, chills, or other influenza-like illness symptoms occur and if professional medical care is not available within 24 hours. Self-treatment of a possible malarial infection is only a temporary measure and immediate medical care is important. Appropriate options for a reliable supply of malaria treatment medicines are atovaquone or preguanil or artemether or lumefantrine. Malaria can be treated. If the right drugs are used, people who have malaria can be cured and all the malaria parasites can be cleared from their body. However, the disease can continue if it is not treated or if it is treated with the wrong drug. Some drugs are not effective because the parasite is resistant to them. Some people with malaria may be treated with the right drug, but at the wrong dose or for too short a period of time. Two types, species, of parasites, Plasmodium vivax and P. avali, have liver stages and can remain in the body for years without causing sickness. If not treated, these liver stages may reactivate and cause malaria attacks, relapses, after months or years without symptoms. People diagnosed with P. vivax or P. avali are often given a second drug to help prevent these relapses. Another type of malaria, P. malariae, if not treated, has been known to stay in the blood of some people for several decades. However, in general, if you are correctly treated for malaria, the parasites are eliminated and you are no longer infected with malaria. Malaria treatment. The treatment your doctor recommends will depend on things like the type of parasite you have, how bad your symptoms are, the geographic area where you got infected, your age, whether you're pregnant. Medications doctors use to treat malaria include 1. Chloroquine or hydroxychloroquine. Your doctor may recommend one of these drugs if your symptoms aren't serious and you're in an area where the parasite hasn't become resistant to chloroquine. 2. Artemisinin-based combination therapy, ACT. This combines two medicines that work in different ways. They're used to treat milder cases of malaria or as part of a treatment plan for more serious cases. 3. Atovaquone preguanil, artemether lumefantrine. These combinations are other options in areas where the parasite has become resistant to chloroquine. They also can be given to children. 4. Mefloquine. This medication is another option if chloroquine can't be used, but it's been linked to rare but serious side effects related to your brain and is only used as a last resort. 5. Artesunate. If your symptoms are severe, your doctor may recommend this drug as treatment for the first 24 hours, then follow it with 3 days of artemisinin-based combination therapy. Some parasites that cause malaria have become resistant to almost all the medicines used to treat the illness, so researchers are always looking for new drugs that work. Malaria complications. Some people are more likely to have serious health problems if they get malaria, including young children and infants, older adults, people who travel from places that don't have the vaccine, pregnant women and their unborn children. These health problems can include coma, cerebral malaria, brain damage caused by swelling, pulmonary edema, liver, kidney, and spleen failure. Anemia, when you lose too many red blood cells, very low blood sugar. Prevention of malaria. If you live in or are traveling to an area where malaria is common, take steps to avoid mosquito bites. Mosquitoes are most active between dusk and dawn. To protect yourself from mosquito bites, you should 1. Cover your skin. Wear pants and long-sleeved shirts. Tuck in your shirt, and tuck pant legs into socks. 2. Apply insect repellent to skin. Use an insect repellent registered with the Environmental Protection Agency on any exposed skin. These include repellents that contain DEET, picaridin, IR 3535, oil of lemon eucalyptus, OLE, paramenthane 3,8-diol, PMD, or 2-on-decanone. Do not use a spray directly on your face. Do not use products with OL or PMD on children under age 3. 3. Apply repellent to clothing. Sprays containing permethrin are safe to apply to clothing. 4. Sleep under a net. Bed nets, particularly those treated with insecticides, such as permethrin, help prevent mosquito bites while you are sleeping. Preventive medicine. If you'll be traveling to a location where malaria is common, talk to your doctor a few months ahead of time. Ask him about whether you should take drugs before, during and after your trip to help protect you from malaria parasites. In general, the drugs taken to prevent malaria are the same drugs used to treat the disease. What drug you take depends on where and how long you are traveling and your own health. Vaccine for malaria. The World Health Organization has recommended a malaria vaccine for use in children who live in countries with high numbers of malaria cases. Researchers are continuing to develop and study malaria vaccines to prevent